Good afternoon, everyone. So today's histology topic is microscopic structure of blood vessel or histology of blood vessels. Okay. Now, before going to the blood vessels, let's try to understand how the blood is flowing in our body. Okay. Now, have you studied about CBS in physiology? CBS, is it started? Cardiovascular system? No. Okay. But still, in 10th, 12th standard, you have studied something about the heart and you know about the types of circulation in our body. So, if you see, the blood is come. So, you can see that blood is coming out from the heart. Okay, once it coming out from the heart, okay, then where it will go? It will go to the larger arteries. Those are also called as elastic arteries. Okay, now in case of elastic arteries, just see the diameter is more than 10 millimeter. Next, medium size arteries are there, also called as muscular arteries, and you can see the diameter. Okay, like this the blood is flowing, then small arteries are there, after that arterioles. Okay, from arterioles we are getting the capillary bed where capillary plexuses are present. After that, post capillary venule, from here the venous system start, veins start. After that, muscular venule, small veins, medium size vein, large vein, and again then venous blood will drain into the heart. Okay, so in our body the blood which is flowing, it is a closed circulation, right? You have studied about that. Now different types of circulations are there. Okay, for example, systemic circulation, pulmonary circulation, portal circulation. Okay, three different types of circulations are there that you will study in CBS, cardiovascular system. Now, though we are going to discuss about the histology of blood vessel, okay, that means microscopic structure of blood vessel. Before that, you must know how the blood is flowing in our body. तो निकलता कहाँ से है blood? Heart से, okay, and then it is supplying all around or various tissues of our body, and then again it is going back to the heart. ठीक है? So when it is coming out from the heart, as you can see, it is large artery or elastic arteries. Okay. Next, when it is going back to the heart, you can see large veins. Now, at each and every section, you have to study the microscopic structure. For example, if you see the large artery, elastic artery, okay. Suppose a large artery, elastic artery is there. You have taken the artery, you have prepared the slide. After that, if you see under microscope, okay. So these blood vessels which are listed over here, for each and every blood vessel you have to know the basic structure. Now you will say that so many blood vessels are there, how it is possible to know? So there is a similarity between almost all the blood vessels. Okay, first you have to understand that similarity, then depending on the size, depending on the area, and depending on the function, okay, some changes are there. But a basic similarities is there in each and every type of blood vessel. Okay, so that we have to see in today's class. Now, if you see the basic structure of blood vessel, as I said that a similarity is there, so we will try to understand the similarity. For that, जितना भी blood vessel है, उसका एक basic structure रहता है. Okay. Now, depending on the blood vessel, depending on the area where they are present, and depending on the amount of blood which is carried by them, some changes are there. Okay, but basically some similarities are there. Okay. Now, if you take any blood vessel histologically, it is made up of 3 layers. Okay, don't forget that. कोई भी blood vessel में histologically 3 layers रहता है. What are they? Tunica, intima, from inside to out. Okay, that means this is the innermost layer and this is the outermost layer. Tunica का मतलब है coat or coating. So first is the tunica intima, tunica media, and tunica adventitia. These are the layers, 3 different layers of any blood vessel. Now, when you will go to artery, when you will go to the elastic artery, muscular artery, then large vein, medium size vein, everywhere these 3 layers will be there. Okay. Now there may be some changes, but these 3 layers are constant. Okay. Next, if you see the thickness of these layers, it depends on the size and type of the blood vessel. तो ये 3 layer का जो thickness होता है, okay, and constituent of those layers, it depends on the size and thickness of the blood vessel. Now I want to show you one diagram. So this is a 3D diagram of showing the general structure of blood vessel. So how many layers are there in any blood vessel? 3 layers are there. Okay, what are they? Tunica intima, tunica media, and tunica adventitia. So you can see in the diagram, this is the tunica media. Here you can see, sorry, this is the tunica intima, this is the tunica media and tunica adventitia. Okay. Now, in case of tunica media, in case of tunica intima, first you can see the lumen of any blood vessel. It is lined by endothelium. Now, what is this endothelium? It is nothing, huh? No, lumen inside. It is lined by endothelium. Now, what is this endothelium? It is nothing but simple squamous epithelium. Okay, to see whatever we have studied earlier in epithelial tissue, now we are applying it. As we will go further, we have to apply all those things again. So endothelium, at that time I have mentioned about endothelium, if you remember, and you have written also somewhere. Okay, so first you can see endothelium. Now, what about the structure of any epithelial tissue? Do you remember? First of all, if it is single layer, okay, then some simple squamous epithelium, then below that what will be present? Basement membrane, okay, or also called as basal lamina. So you can see the basal lamina can be seen. So here endothelium which is resting on the basal lamina. Now after that subendothelial connective tissue is present, okay, because we know that जो epithelial tissue है, it don't have blood supply, direct blood supply is not there. Below that subendothelial connective tissue is present. From that connective tissue it is getting the nutrition. Okay? So here you can see subendothelial connective tissue. And after that you can see internal elastic lamina. This is the internal elastic lamina. Now this internal elastic lamina is mainly made up of sheets of elastic fibers. Okay? So these things are present in the tunica intima. After that we are getting the tunica media. In tunica media mainly two things are present. That is the smooth muscle cells and the elastic lamellae or the sheets of elastic fibers. And depending on the blood vessel the amount varies. But these two constituents are majorly present in the tunica media. Next, lastly, the outermost layer is the tunica adventitia. You can see where different types of fibers are present. Mainly, you can see collagen fibers are there. Okay, along with that, some elastic fibers may be present, but mainly collagen fibers are there. Okay. Now, along with the collagen fibers, you can see some structures which are coming out. These are called as Vasa, Vasorum, Nervi, Vasorum. I don't think so. You have heard about this. So, ये क्या होता है? What is the concept behind it? This, now see, this is a blood vessel, right? And you can see another blood vessel is present over here, right? So we are studying about the structure of blood vessel, but you can see another blood vessel which is present on the outer aspect of this blood vessel. तो इसका मतलब क्या है? What is the meaning of that? Now, as I have mentioned that 3 different layers are there, right? So first layer is a tunica intima, second layer is tunica media, and then adventitia. Now whenever blood is flowing through this blood vessel, at that time most of the layers, okay, innermost layer, they are getting nutrition by diffusion from the blood itself. But the outer layers, how they will get the nutrition? For that, such kind of small arteries are responsible. So what they will do, they will carry the blood and they will supply the outermost layers. Okay? That's why it is called as Vasa Vasorum. Similar way, if blood vessel is there, then nerve supply is also required. That's why it is called as Nervi Vasorum. Now this Nervi Vasorum, what it will do, it is mainly postganglionic fibers of a sympathetic nervous system, and they are doing the vasoconstrictions. Okay, they are doing the vasoconstrictions. So that is the Nervi Vasorum. Okay. So I hope it is clear about the general structure of a blood vessel where we are having 3 different layers. Now in this chart you can see what is present in 3 different layers. So first of all, tunica intima is there. So in tunica intima, what we are getting, simple squamous epithelium, also called as endothelium. So in most of the books I have seen, they have written as endothelium. So you may get confused. So after writing endothelium, you can give a bracket and you can write it is simple squamous epithelium. Okay. Next, subendothelial connective tissue. Now, after writing the endothelium, you have to mention that basal lamina is present. Below the basal lamina, subendothelial connective tissue is there, which is nothing but a loose connective tissue. Okay. After that, internal elastic lamina is there, where fenestrated elastic sheets are there. What is the meaning of fenestration? Anyone? What is the meaning of fenestration? Fenestrated sheets का मतलब है tiny or micropores are present. That is the fenestration. Okay, microscopic pores are present. So that is the fenestrated elastic sheets are present. That means made up of elastic fibers. Second layer, the middle layer is called tunica media. Now in the tunica media, we have seen what is present. Smooth muscle fibers and elastic fibers are present. So you can see smooth muscle fibers which are concentrically arranged. Somewhere it is spirally arranged. Okay. And fenestrated elastic sheets are also there. Now, one thing you have to know that here you can see internal elastic lamina is there. Now, this internal elastic lamina is separating or demarcating the tunica media from the tunica intima from the tunica media. मतलब ये दो लेयर के बीच में ये रहता है इंटरनल इलास्टिक लेमिना रहता है. ठीक है. This internal elastic lamina is differentiating, or you can say it is separating these two layers. Okay. Next, if you see the tunica media, here also we are getting the external elastic lamina. Now this external elastic lamina is separating the media, tunica media from the tunica adventitia. Okay. Now in some blood vessels, this tunica, so this one internal elastic lamina and external elastic lamina is clearly visible or prominent, and in some blood vessels it is not prominent. So these are also some important identifying feature by which you can identify which type of blood vessel is that. Okay. And lastly, the adventitia, where different types of fibers are there, collagen fibers, elastic fibers, and along with that Vasa, Vasorum and Nervi, Vasorum. So we have seen what is Vasa, Vasorum and Nervi, Vasorum. Okay. Now in thorax, when we'll study the thorax next week, from next week onwards, I think most probably thorax will be started. Okay, you can check the routine. Next week se thorax start ho jayega. So when we will start the thorax, at that time, first time you will study about the organs. Till now we have not studied any organs. Upper limb में कोई organ नहीं है. ठीक है. So when we will study the thorax, at that time, first time we will be studying about some organs. Okay. Almost two important systems are associated with that, respiratory system and cardiovascular system. Entire respiratory system is not present in the thorax. Okay. Most of the respiratory system is present. Some part is present in the neck also. So at that time, when you will study the heart in CVS, cardiovascular system, at that time you will come to know one important chapter that is called coronary circulation. Okay, coronary circulation. So this coronary circulation is nothing but the best example of this Vasa, Vasorum, the coronary arteries, because we know that heart is supplying blood to whole of the body, entire body. How the blood is supplied? By heart. The heart is getting blood supply by these coronary arteries, because heart also required blood, and that is the best example of Vasa, Vasorum. Okay. Next, the classification of blood vessels. So in the beginning, have you seen? I have mentioned about so many blood vessels, name of so many blood vessels. Right. Now we have to classify the blood vessel. Now functionally, the blood vessels are classified into 5 categories. You can see conducting blood vessels. That is the large arteries. Okay, that means the blood, when it comes out from the heart, so it has to be conducted from heart to the various part. And for that, we are getting the conducting blood vessels. These are large arteries. Then distributing vessels. So various areas are there in which the blood has to be distributed. For that, we are getting the distributing arteries. Then resistant vessels are there, where the velocity of blood is very less. Okay, and it is giving resistance to the flow to the blood. That is the resistant blood vessels. Example, arterioles are there. And then exchange vessels, where exchange of nutrients, exchange of gaseous materials are taking place. That is the capillaries, sinusoid, post capillary venules. and after that capacitance or reservoir vessels, that is the large venules and veins. Okay, so these are the functional classification of blood vessel. Okay, so now we will start one by one, that is the microscopic structure. So which is the first one? Conducting vessel. Now please note that conducting vessels are also called as large arteries. In some books I have seen that it is written as large arteries. So large arteries का meaning and conducting arteries का meaning is same. Now see, conducting vessel is also called as large artery or also called as elastic artery. Okay, three different terminologies are there: large artery, elastic artery, or conducting arteries. Okay, so here what you have to know, or how we'll proceed with the structure, microscopic structure. We have to see three layers. Always keep that in mind. कोई भी blood vessel आया, blood vessel mainly histology से ही आता है एग्जाम में, ठीक है? तो कोई भी blood vessel से क्वेश्चन आया हिस्टोलॉजी का, मे बी आर्टरी, मे बी वेन, ओके, what you have to do, you have to describe with the help of these three layers. ठीक है, you have to describe with the help of these three layers. That means tunica intima, tunica media, and tunica adventitia. Okay, now what is special, or what are the important identifying features present in that particular blood vessel that you have to mention, वो mention करना है. So now we are discussing about the elastic artery. तो जो elastic artery है उसमें ये तीन layers मिलता है. So in those three layers, what is special, okay, or what is different from other blood vessels, that we have to know. Okay, why I am telling you this, or else तीन layers सब में present है, how will differentiate, right? So that's why you have to know which is special and which is important for identifying this particular blood vessel. Now in case of elastic artery, see, first tunica intima is there, so same endothelium is present. Endothelium सब में रहेगा. Endothelium, what is endothelium? Simple squamous epithelium. ठीक है, if anyone asks you what is endothelium, it is example of simple squamous epithelium. Now I have seen that in most of the books, so many things they have given about the endothelium. ठीक है, even the EM structure of the endothelium is also given. Okay, so that is not required right now. Okay, if you know that much the endothelium is present, that is more than enough. Now one thing you must know, that जो endothelium का arrangement होता है, the arrangement of the long axis of the endothelium, it is parallel to the flow of the blood. जो ब्लड वेसल के अंदर जो लुमेन है, लुमेन में जो एंडोथेलियम प्लेस रहता है, सो उसका जो लॉन्ग एक्सिस है एंड द ब्लड फ्लो, दोज आर पैरेलल टू ईच अदर. ओके, बिकॉज ऑफ दैट ओनली द ब्लड कैन फ्लो इजीली. नाउ इफ समवन आस्क यू व्हाई endothelium is present, why not other epithelium, then what will be your answer? Why endothelium is present? Why not other epithelium, other types of epithelium? See, endothelium, when you have studied, we have studied that the width of the cell is more as compared to the length of the cell. तो अगर width ज़्यादा है तो it is having more surface area. Okay? So if more surface area, that means the blood can flow easily without having any resistance. That's why simple squamous epithelium is present. Okay, so endothelium is there, just below the endothelium, subendothelium connective tissue is present, and then internal elastic lamina is present. Okay, now here internal elastic lamina, as I said, it is made up of elastic fibers, sheets of elastic fibers. Next, in tunica media, now here you have to notice one thing, that internal elastic lamina is not prominent, indistinguishable. इसका मतलब है it is not prominent. Now previously I have mentioned that जो internal elastic lamina है, what is the main function? It is separating tunica intima and tunica media. दोनों layer को separate करता है, ठीक है? This layer. Now in this case, this layer is not well defined. Okay, ये indistinguishable है, means you cannot see, रहता है but prominent नहीं है. This is not prominent feature. Next, if you see the tunica media, many layers of smooth muscle fibers and multiple layers of fenestrated elastic lamellae or elastic fibers are present. Now please keep that in mind, that in case of elastic artery, both the things are present in the tunica media. That means smooth muscles are present and elastic fibers, the sheets of elastic fibers are present. But the amount of elastic fibers, sheets of elastic fibers are more as compared to the smooth muscle fibers. Okay, this is the important identifying feature. Why I am telling you this? Because when you will see the slide under microscope, okay, at that time very few smooth muscle cells will be seen. Instead of that, you will see more amount of elastic fibers, sheets of elastic fibers. Okay. Next, tunica adventitia. Now, in case of tunica adventitia, it is relatively thin. So this layer is relatively thin and longitudinal collagen fibers are present. Okay. So ये जो layer है, it is thickest. This particular layer is the thickest. First this layer, then this layer is the thickest, and after that this here the tunica adventitia which is present is very thin. Now in this layer we are getting longitudinal bundles of collagen fibers. Now here is the diagram. Okay, so you can see the diagram. So in case of elastic artery, first of all tunica intima is there where endothelium is there. So you can see this is the endothelium, then subendothelial connective tissue. This is the subendothelial connective tissue. Okay. Now the first layer of elastic tissue fibers is called internal elastic lamina. So here internal elastic lamina is present, but it is not prominent, as you can see in the diagram. ठीक है, ये देखो internal elastic lamina रहता है, but it is not prominent. Next, this most of the thickness you can see it is made up of tunica media. Okay. Now internal elastic lamina is not distinct from the elastic fibers of the media. Next, tunica media is having many elastic fibers as compared to the smooth muscle fibers, and most of the thickness is made up of tunica media. Okay, where you can see the elastic lamina, that means the sheets of elastic fibers, and very few smooth muscle cells are present. Okay. Now how to differentiate between the, if someone asks you how to differentiate between the smooth muscle fibers and elastic lamina, how you will differentiate? कैसे differentiate करोगे? Because this you have to see under microscope. Huh? No, how you will differentiate? Very simple. No. Wait. Yes? Pores are not present over here, no. हाँ, तो same thing she have said. Fenestration का मतलब pores ही होता है. Apply common sense. In case of muscle fibers, you can see the nucleus. ठीक है? In case of elastic fiber, you cannot see nucleus. Elastic fiber में कोई nucleus नहीं रहता है. ठीक है? Now, for example, this is elastic lamina. This is one elastic lamina. This is one elastic lamina. Can you see any nucleus over here? No. But if you see the nucleus, जहाँ पे nucleus दिखाई दे रहा है, वहाँ पे muscle fibers हैं, smooth muscle fiber. Okay, like this we can differentiate. तो can you see the thickness of the tunica media? ये देखो, most of the thickness यहाँ से लेके यहाँ तक most of the thickness is made up of tunica media. तो tunica media में क्या रहता है? Two things are there. Elastic fibers, that also they are in the form of lamina, okay, or you can say in the form of sheets, and in between them small amount of smooth muscle fibers are present. ठीक है? Next, lastly, you can see the tunica adventitia. See, the thickness of tunica adventitia is very less. So here you are getting the collagen fibers with several elastic fibers. Now in tunica adventitia, another important point, that is Vasa Vasorum is present. Now in each and every case you will not see the Vasa Vasorum, but it can be seen. And what is Vasa Vasorum? I have shown you earlier. ठीक है? तो tunica adventitia is the outermost layer. ठीक है? This is the innermost layer, this is the outermost layer. तो blood जो है यहाँ से flow हो रहा है. ठीक है? Please keep that in mind. Blood यहाँ से flow हो रहा है, and this is the outermost layer. तो blood जब flow हो रहा है, तो from diffusion the inner and middle part is getting nutrition, but जो outer part है, they also need nutrition. तो how they will get nutrition? With the help of Vasa Vasorum. ठीक है? So in case of tunica adventitia, first of all, it is very thin in case of elastic artery. Next, in tunica adventitia, we are getting the collagen fibers and some amount of elastic fibers. Mostly, it is made up of collagen fibers. Okay, very few elastic fibers are present. Next, Vasa Vasorum can also be seen. Now, I am having another diagram. So, two diagrams are present over here. This is the schematic diagram, and this is the low magnification image of elastic artery. Okay. Now, if you concentrate over here, can anyone tell me which is the innermost layer and which is the outermost layer? This is the innermost layer. This is the outermost layer. ठीक है? So ये हो गया lumen. तो यहाँ से blood flow हो रहा है. Now, can you see the endothelial layer? Can you see the endothelial layer? Okay, so see, this is the endothelial layer. You can see the endothelium. That is the simple squamous epithelium. Just deep to the endothelium, this is the subendothelial connective tissue. Okay, so this much is the tunica intima. After that, ये जो पूरा layer है, this is the tunica media. So in the tunica media, mostly you can see the elastic fibers. और जहाँ पे ये डॉट दिखाई दे रहा है वायलेट कलर का, दिस आर नथिंग बट द स्मूथ मसल फाइबर्स. दिस इज हाउ वी कैन डिफरेंशिएट द इलास्टिक लेमिना एंड द स्मूथ मसल फाइबर्स. ठीक है. एंड लास्टली हियर यू आर गेटिंग द एडवेंटिशिया. नाउ इन एडवेंटिशिया, इन दिस पर्टिकुलर इमेज यू कैन सी द क्रॉस सेक्शन ऑफ द ब्लड वेसल्स. सो दिस आर नथिंग बट द वासा वेसोरम. ओके, तो उसमें क्या दिखाई देता है? मेनली इन एडवेंटिशिया कोलाजन फाइबर्स एंड वेरी फ्यू अमाउंट ऑफ इलास्टिक फाइबर्स आर प्रेजेंट. ठीक है. एंड द थिकनेस ऑफ द टुनिका एडवेंटिशिया इज ऑल्सो लेस. सो दिस इज द इलास्टिक आर्टरी. नाउ in case of cartilage, if you remember when you have studied about the hyaline cartilage, ठीक है, or when you have studied the elastic cartilage, fibrocartilage, after explaining the structure we have given examples. Do you remember? जैसे हाइलिन कार्टिलेज है तो what are the examples of hyaline cartilage? इसका मतलब क्या है? What are the location in which areas the hyaline cartilages are present? ठीक है. In the similar way here, once you explain everything, you have to write the examples of the elastic artery. इसका मतलब क्या है? Where it is located, where those arteries are located, at least one or two. So can you name any elastic artery? Find out. Okay, find out the examples of elastic artery. At least two examples. ठीक है. Next is the muscular artery, or also called as medium-sized artery, or also called as distributing vessels. So first we have studied about the conducting vessel. Now we are studying about the distributing vessel, also called as muscular artery or medium-sized artery. Now here, what is present? So see, again three layers are there. So as I said, any blood vessel, whatever we will study, these three layers will be there. Okay, and in among these three layers, one thing is common, that is the endothelium. सब में रहता है. ठीक है. तो एग्जाम में आया, if you write that in this three layer endothelium is present, the first layer, you are correct. Okay, after that other things may change, but endothelium सब में रहता है. So you can see tunica intima, first endothelium is there, but below the endothelium, the subendothelium connective tissue is very less in case of muscular artery. To see, we are getting the first difference. In case of elastic artery, normal amount of subendothelial connective tissue was there, and I have shown you in the diagram. But here the subendothelial connective tissues are very less. ठीक है, it is scanty. Next, prominent wavy internal elastic lamina can be seen. So previously we have seen that internal elastic lamina is indistinguishable, or you can say it is non-prominent, but here it is prominent in nature. Easily it can be seen. Next, if you see the tunica media, it is thick. More amount of smooth muscle fibers are there as compared to the elastic fibers. Okay. तो जो इलास्टिक लेमिना होता है, नंबर ऑफ इलास्टिक लेमिना और नंबर ऑफ शीट्स ऑफ इलास्टिक फाइबर्स आर लेस, बट नंबर ऑफ स्मूथ मसल फाइबर्स आर मोर in the tunica media of muscular artery. Next, tunica adventitia, it is relatively thicker than the elastic artery. Here Vasa Vasorum and Nervi Vasorum are also present. Structure same रहता है tunica adventitia, but here the thickness is more as compared to the elastic artery. Okay, so these are the differences between the elastic artery and muscular artery. Now let's see the diagram. Okay, now just compare with the diagram. So in case of muscular arteries, tunica intima is made up of endothelium and internal elastic lamina is there. Now one thing you have to notice that when you will see the lumen of the muscular artery, at that time you will see that it is wavy in nature. Okay, ऐसे wavy रहता है. As you can see over here, ये wavy है. Okay. Now wavy folds are there. Why? Because due to the contraction of the smooth muscle. Because number of smooth muscle cells are more. ठीक है, because of the contraction of the smooth muscle cells, the lumen is wavy in nature. Next, tunica media is composed of mainly smooth muscle fibers which are arranged circularly, mainly, and some amount of elastic fibers are present. Next, if you see the adventitia, fibroelastic connective tissue is there, okay, and as thick as the media in the smaller arteries. And in the inner part of the adventitia, more elastic and collagen fibers are present. So collagen fibers are present, and along with that, we are also getting the fibroelastic connective tissue in the adventitia. Okay. Now here you can see the diagram. Okay. तो क्या दिखाई दे रहा है diagram में? What you can see? So which is the innermost layer and which is the outermost layer? Yes, this is the innermost layer. ठीक है? This is the innermost layer. That means this is the lumen. तो यहाँ से ऐसे blood flow हो रहा है. तो what we are getting over here? Endothelium. तो पहले ही कोई भी ब्लड वेसल आया, व्हाट यू विल राइट फर्स्ट इज द एंडोथेलियम. टुनिका इंटिमा, इसके बाद फर्स्ट पॉइंट व्हाट यू हैव टू राइट एंडोथेलियम. तो यू कैन सी द एंडोथेलियम. ठीक है, एंडोथेलियम के नीचे क्या रहता है? सब एंडोथेलियल कनेक्टिव टिश्यू. नाउ हियर यू कैन सी द अमाउंट ऑफ सब एंडोथेलियल कनेक्टिव टिश्यू इज लेस. ओके, क्वांटिटी लेस है बट कम है. आफ्टर दैट कैन यू सी दिस लेयर? दिस इज द internal elastic lamina. Now this internal elastic lamina is very prominent in case of muscular artery. Okay, and this internal elastic lamina is separating the tunica intima and tunica media. ठीक है, तो ये internal elastic lamina है. This is the tunica intima and this is the tunica media. Okay, you can see this is the tunica media. Next, what happened? जो tunica media and tunica adventitia है, here it will be difficult to identify the difference. Clear cut demarcation नहीं है, because external elastic lamina here it is not prominent. That's why it will be very difficult. But how to identify the tunica media and tunica adventitia? In case of tunica adventitia, you will be getting the fibroelastic connective tissue, as I have mentioned. Fibroelastic connective tissue is present, and along with that, Vasa Vasorum are also present. Okay, this is how we can differentiate. Now, if I ask you, why? See, I have projected one diagram, histological diagram, ठीक है? And no labeling, no markings are there. Now, if I ask you to identify which type of blood vessel is this, and identify the layers also. See, you have to practice such kind of things. Why? Because during the time of practical exam, this kind of things will be there. Just imagine that you are looking at a slide under microscope and such kind of appearance is there. तो वहाँ पे कोई labeling, nothing will be there. So you have to identify, you have to write the identifying features. That also within 1 minute. ठीक है? तो that's why you have to practice. If you don't practice, you cannot identify. So though we have studied both the arteries, elastic artery plus muscular artery, features and differences, and I have shown you the diagrams also. Now, based on the understanding, can you identify which type of blood vessel is this? Muscular artery. Why it is muscular artery? Wait, one by one. So first what you have to see? अच्छा, पहले बोलो ये लो पावर में है या हाई पावर में है? लो पावर. This is under low power. Very good. नेक्स्ट तो इनर पार्ट कौन सा है, आउटर पार्ट कौन सा है? ओके, वेरी गुड. तो दिस इज द इनर पार्ट, दिस इज द आउटर पार्ट. कैन यू सी द एंडोथेलियम? ये तो एंडोथेलियम दिखाई दे रहा है. ठीक है. हाँ, आफ्टर दैट कैन यू सी द लुमेन, इट इज वेवी, ऐसे वेवी है. ओके. नेक्स्ट यू कैन सी ये जो डॉट डॉट दिखाई दे रहा है, though it is under low power, that's why it will be difficult to see the endothelium, but still you can see ये जो nuclei दिखाई दे रहा है, these are nothing but the endothelium. Below that you can see subendothelial connective tissue is present. Okay. After that, can you see a pink color marking area? right? This is the internal, no, prominent internal elastic lamina. ठीक है, prominent internal elastic lamina. So after that, this pura layer, this is what? Tunica media. Very good. So the देखना है. Can you see these small dots? These are nothing but the smooth muscle cells, smooth muscle fibers. Okay. और जहाँ पे dot दिखाई नहीं दे रहा है, those are nothing but the elastic fibers. ठीक है. After that, if you come over here, ये वाला जो part है, this is the Adventitia. Now in Adventitia, see, this is the Vasa Vasorum. ये देखो Vasa Vasorum दिखाई दे रहा है. Okay, ये देखो. Okay, here also you can see. Okay, so this is how the okay. Now here you can see the differences between the elastic artery and muscular artery. Okay. So whatever we have discussed, you can see everything is mentioned over here. So whenever you are studying about the differences between the elastic and muscular artery, please try to read the differences along with these 3 points. And do you remember I have asked you about the examples? To see, this is the examples of the elastic artery, this is the examples of the muscular artery. Okay, example देना ही है. In whenever you are writing about the histology of elastic artery or muscular artery, ठीक है, once you explain everything, draw the diagram, you have to write the examples, at least 2 examples. Okay, so here you can see the example. So about each and every layer, what are the differences? It is mentioned over here. Okay, just go through it, you will understand. Okay, next are the muscular arteries. तो जो muscular arteries है, so we have discussed about the muscular arteries. Next, the muscular arteries, they will divide, redivide and give rise to very small arteries, and those are called as arterioles. जो muscular artery होता है, they will divide and redivide, ठीक है, to give very small arteries, and those are called as arterioles. ठीक है. Now in case of arterioles, if you see the diameter, it is approximately 10 to 100 micrometer. It is the diameter of arterioles. Now distally, arterioles, they form the capillary plexus. Now after arterioles are the smallest arteries of our body. Please keep that in mind. जो arterioles होता है, these are the smallest arteries of our body. Beyond that, capillary bed is formed. ठीक है. Next, arterioles are of 2 types, muscular or large arterioles and terminal arterioles, where diameter is less than 50 micrometer. Okay. Now if you see the arterioles, main function is they regulate the flow of blood through the capillary plexus and maintain the blood pressure. तो जो arterioles होता है, through arterioles blood is flowing through the capillary bed. Okay, and then it will go to the venous end of the capillary bed. So these arterioles, what they will do, they will regulate the blood flow. Now here also all 3 layers are present. So in the beginning I have mentioned, कोई भी blood vessel हो, ये तीनों layer रहेगा, but there will be some differences. So we have seen the differences. Now here also some differences are there. Now all these 3 layers are present. Okay. Now terminal arterioles give off lateral branches, and those are called as meta-arterioles. Now this is very important. Okay, meta-arterioles are also present in the capillary bed. ठीक है. From arterioles we are getting the capillary plexus, but they are giving some lateral branches, because as I have mentioned, arterioles are the smallest arteries. But वहाँ से भी lateral branches निकलता है, which is forming the meta-arteriole. Now, if you see the structure of the arterioles, tunica intima have small amount of subendothelial connective tissue, and internal elastic lamina is absent. You cannot see internal elastic lamina. Okay. Here you can see the diagram of arteriole also. Now, in case of muscular arteriole, 2 to 3 layers of smooth muscle layers are there. Where in case of terminal arteriole, only 1 layer of smooth muscle cells are present. That is the difference. And if you see the tunica adventitia, here we are getting very thin layer of connective tissue which separates the arterioles from the adjacent structure. Okay. Now this connective tissue may not be clearly distinguishable, but it is present, which is separating the you can see the arteriole with the surrounding structure. Okay. Next, here you can see, so this is the arteriole. Okay. Now, after arteriole, you can see the capillary bed is formed, and this is the venule. Okay. This is the venous end of the capillary. Now, there is a structure that is called thoroughfare channel. Have you heard about it? No. तो क्या होता है? Sometimes to maintain or to regulate the blood pressure, whenever blood is flowing through the arteriole, okay, when it enters the capillary bed, at that time what will happen? When the blood enters the capillary bed, what will happen? The surrounding tissues will get the nutrition. Now, when the blood pressure has to be maintained, at that time what happens? ये pre-capillary sphincters रहता है. Okay, when these pre-capillary sphincters are closed, at that time blood will not be able to flow through the capillary network. Instead of that, it will bypass the capillary network and then it will go to the venule. Now, when it is bypassing the capillary network and going to the venule, it is going through the thoroughfare channel. That is the importance of the thoroughfare channel. Okay. Okay. So that is all about the arteries. So we have seen up to the arterioles, which is the smallest one along with the structure. Next is the veins. So you know that veins, they carry deoxygenated blood towards the heart. Okay. Now based on the diameter, different types of veins are there. That is venules, which is the smallest one, then medium sized vein and large veins. These are the different types of veins present in our body depending on the diameter. Now if you see the venules, these are the smallest. Now they all consist of endothelium, basal lamina and thin Adventitia is present, where longitudinally running collagen fibers are there. Okay. Now the venules which are present here, also different types are there, especially the post-capillary venules are there. Okay. Now in case of venules, the permeability are higher, that's why it allows the exchange of material into the surrounding tissue from the blood. Okay, that is one important function. Now in particular venules, these are the sites at which lymphocytes and other cells may pass into the bloodstream, or from the bloodstream it is going into the surrounding tissue because of the high permeability of these venules. So as I said, two types of venules are there, post-capillary venules and muscular venules, that also depending on the diameter. Okay. Now if you see the post-capillary venules, they receive blood from the capillaries and they are lined by endothelium cell and pericytes only. Okay. Pericytes are the special types of cell, okay, having contractile property in them. Okay, and their contraction and relaxation helps in to maintain the flow of blood through the venules. In case of muscular venules, they are lined by endothelium and 1 to 2 layers of smooth muscle cells surrounding by a thick connective tissue. So here you can see this is the diagram of the venule. Okay. Now if you see the diagram of the venule and if you see the diagram of the arteriole, क्या difference दिखाई दे रहा है? The diameter is larger. Diameter large रहता है. That means you can see the lumen is larger, but the overall thickness is less in case of venule. यहाँ पे thickness ज़्यादा होता है. Okay. Next, the medium sized vein. Now in case of medium sized vein, how to differentiate the medium sized vein based on the diameter. Okay. Let me show you the diagram. So here you can see the diagram of the medium sized vein. So in medium sized vein, the diameter remains from 1 to 10 millimeter. Okay. Now poorly identifiable 3 layers are present. 3 layers are there, but identification of those 3 layers or distinguishing between these 3 layers are very difficult. You cannot distinguish. Okay. Now one important property is there, okay, in the medium sized vein, that is the presence of valves. Okay. You have heard that valves are present in the heart, but valves are present in the veins also. Do you know that? हाँ, veins के अंदर भी valves रहता है. Okay. Now, when you will study the lower limb, at that time there is a very important chapter that is called venous drainage of lower limb. So, in that you will be studying the veins of the lower limb, they carries valves. So why those valves are present? Any idea why those valves are present inside the veins? Yes, to prevent the backflow of the blood. That means they maintain the uniform direction of the flow of blood. Okay, and those veins are mainly present inside the medium sized vein. Okay. Now, if you see the diagram, so here this is the diagram of vein where these three layers are there. Now, if you go to the lumen, okay, you can see the valves are present. Now, what is the structure of the valve? Any idea what is the structure of the valve? Now, first of all, typically each valve is made up of two semilunar cusps. Okay, so दो cusp रहता है, that also semilunar in shape. Each cusp is made up of endothelium, which are some connective, along with that some connective tissue and rich elastic fibers are there. This is the structure. Okay, detailed structure will be discussed in the CBS cardiovascular system. For the time being, please keep that in mind. The endothelium lining is there of the cusp, along with that connective tissue and elastic fibers are present. Okay. Now, what is the function of the valve? Unidirectional flow of blood. It maintains the unidirectional flow of blood, and mostly you will see that the valves are present in the veins of lower limb. Okay, because in lower limb the blood has to flow against the gravity. Okay, so that's why due to the presence of the valves, okay, the blood is present in the veins in the form of column. Okay, so one valve opens, the blood goes to next column, then this valve will get closed, next valve open, then blood will go to the next column. Like this, columns of blood is present in the lower limb. Okay, this is how the blood is flowing against the gravity in our lower limb. Okay, other factors are also there. Peripheral heart is also present. Okay, the muscular contraction. So that we'll be discussing in the lower limb chapter. Very interesting phenomena is taking place. Okay, when just imagine when a person is standing, okay, upright, at that time the blood from the lower limb is flowing, is going back to the heart. Now, what are the factors responsible for that? Okay, and because there are some factors which, if it affects, okay, for example, valves, if they are not functioning properly, at that time patients are suffering from complications. Have you heard about varicose vein? Quite common. Okay, in elderly people or in obese person, varicose vein is very common. Okay, so such kind of problems occur in that kind of human being. Okay, so that is the importance of venous drainage of the lower limb. Okay, so for that valves are required, and those valves are mainly present in the medium sized vein. Okay. Next is the large vein. So in large vein, again these three layers are present, as you can see. Tunica intima is there, tunica media is there, tunica adventitia is there. Now here you will see the difference. क्या difference रहता है? Now if you see the tunica intima, endothelium is there, basal lamina, subendothelial connective tissue. Okay. Now here you will not get this internal elastic lamina. Okay, यहाँ पे directly internal elastic lamina नहीं रहता है. In the tunica media, it is relatively thinner. In case of muscular artery, elastic artery, we have seen that tunica media is very thick. I have shown you in the diagram. But here उल्टा होता है. जो tunica media है, it is relatively thinner than the adventitia. Few smooth muscles, fibroblasts and collagen fibers are present. Okay. Next, if you go to the tunica adventitia, it is very thick. In case of large size vein, okay, where bundles of smooth muscle cells are present, and in between them few amount of collagen fibers, elastic fibers and fibroblasts are present. That is the arrangement of large veins. Okay. Now here you can see the diagram. So in case of large, the vein has thinner wall as compared to the artery. Now tunica intima, media, adventitia can be made out, but not sharply. Means you can do the differentiation, but the differentiation will not be that prominent. Now if you see the media, it is thin and contains larger quantity of collagen fibers than the arteries. Okay. Next, in case of Adventitia, it is relatively thick and contain considerable amount of elastic and muscle fibers, as you can see in the diagram. Okay, ये देखो, this is the Adventitia, which is more thick. So whenever you will see any vein, at that time you have to focus on the Adventitia. When you will focus on the Adventitia, especially in case of large vein, at that time you will notice that उसका जो thickness होता है, it is more. And in case of Adventitia, more amount of smooth muscle fibers are there, bundles of smooth muscle fibers, and very few amount of collagen and elastic fibers are present. Okay, that is the important identifying feature of large size vein. Now lastly, the difference between the artery and vein. Now if you have to write about the difference between artery and vein, you have to write systematically. ठीक है, you can't write that it is carrying oxygenated blood, it is carrying deoxygenated blood. Those things are gone, those days are gone. ठीक है, so you have to be very specific whenever you are writing. I have seen some students, they will write like this 1 or 2 page unnecessary explaining. ठीक है, that will not help you to get marks. Now you have to be very specific. So just see, for 5 marks only this much you have to write, not 2-3 pages for literature. Why I am mentioning this repeatedly? Because this month, when you are having your first formative exam, 10th, at that time if I see you have written like this 2-3 pages, okay, after evaluation I will call your guardian. ठीक है, so don't take the chance. जो पूछा गया है specifically write to the point, no unnecessary things. And this time I will check it from the beginning itself. ठीक है, is it clear? So just see the difference between the artery and vein. In case of wall, so you have to write like this. These are the points under which the differences can be written. That means if you see the wall of the artery, how does it look? Or if you see the wall of the vein, how does it look like? Okay, now you are studying the upper limb. In upper limb you have studied the brachial artery. Have you studied or have you seen in the dissection class about the cephalic vein, basilic vein? तो when you have seen, क्या करना है? Gloves पहन के feel the artery and then feel the vein. ठीक है, you will get the difference. जो vein का wall होता है very thick. If you pinch it, it may break the wall. But जो arterial wall होता है, ये thick होता है. You can feel it. ठीक है, तो dissection में without writing this assignments and all, without wasting time in the dissection hall, try to see all those things. Okay, that will help you. Next, if you see the lumen, here it is oval circular pattern, but in case of vein it is collapsed and it is irregular. Next, internal elastic laminae is well defined, and here it is absent or not ill defined. Next, tunica media, thicker in case of vein, it is thinner than arteries. Okay. Next, in tunica media only, the Adventitia is thicker. Okay, but here it is thinner than Adventitia. That means यहाँ पे जो है tunica media, it is thin in case of vein, but in case of artery, the tunica media is thick. Okay, we have seen the differences. Next, if you see the Adventitia, connective tissue is present, but here smooth muscle cells are there, elastic fibers are present. Okay. Next, layers, all 3 layers of the vessels are well defined. Now here in small and medium size vein, all 3 layers are not clearly defined, but in case of large size vein, at least you can clearly define or clearly demarcate the layers. Okay, these are the difference between artery and vein. This is the way how you have to write the differences between artery and vein. Okay, next are the capillaries, last part. So you know that capillaries are and just now I have shown you the diagram also. So capillaries are the smallest blood vessels of our body. Okay, now if you see the capillaries, they form a network that connects the arteriole and venule. तो artery में सबसे छोटा कौन होता है? Which is the smallest one? Arteriole. Vein में सबसे छोटा venule. तो in between the arteriole and venule, the connection is made by the capillary plexus. Okay. Now if you see the capillary, it has an diameter approximately 8 micrometer. Range is this much. Somewhere it is smaller, somewhere it is larger. Okay. Now there are some areas where the lumen of the capillary is less than the diameter of the RBC. Okay, about the RBCs, the diameter of RBC, I know you have studied in physiology. So if you see the diameter of RBC, there are some areas where the capillary size of the capillary is even smaller. At that time, what happened? The RBCs used to get folded, then only it can pass through the capillary. Okay. Next, in case of capillary, consists of endothelium and basal lamina. That's it. बाकी layers नहीं रहता है. जो कैपिलरी है उसमें क्या रहेगा, एंडोथेलियम रहेगा और एंडोथेलियम के नीचे क्या रहेगा, बेसल लेमिना. No tunica media and no tunica adventitia are present in the capillaries. That is the difference. Okay. Now, in some capillaries, pericytes are present. These are specialized cells, okay, which are embedded in the basal lamina of the endothelium. Now, the question is why these pericytes are present. As I have mentioned, pericytes are specialized cell where contractile elements are present. Okay. So you can see they provide support to the capillary wall and control the size of the lumen. Like this, they controls the amount of blood flowing through the capillary. Okay, because lumen छोटा होगा बड़ा होगा, based on that only the blood can flow through the capillary. Next, on the basis of the morphology, okay, three types of capillaries are there. I don't know whether you have heard or not. That is the continuous capillaries, fenestrated capillaries and sinusoidal capillaries. Okay, three different types of capillaries are there in our body. I will not go in detail. In case of continuous, it is uninterrupted endothelium and continuous basal lamina is present. That means normal endothelium रहता है, endothelium के नीचे continuous basal lamina रहता है. ठीक है. Next, in case of fenestrated, इसमें क्या रहता है, fenestrated endothelium and continuous basal lamina. तो फेनेस्ट्रेशन का मतलब क्या है, स्मॉल टाइनी माइक्रोस्कोपिक पोर्ट्स आर प्रेजेंट. ओके, दैट इज द स्पेशलिटी ऑफ द फेनेस्ट्रेटेड एंडोथेलियम, बट बेसल लेमिना इज कंटीन्यूअस. नाउ इन केस ऑफ साइनोसॉइड व्हाट हैपेंस, एंडोथेलियम विद पोर्स और स्लिट्स आर प्रेजेंट एंड डिसकंटीन्यूअस बेसल लेमिना. तो पोर्स स्लिट रहता है, along with that जो बेसल लेमिना दैट इज डिसकंटीन्यूअस, दैट इज द साइनोसॉइड, दैट इज कॉल्ड एज साइनोसॉइड. सो साइनोसॉइड इज आल्सो ए टाइप ऑफ कैपिलरी. So here is the diagram. This is the continuous capillary. This is the fenestration capillary. Okay, and this is the discontinued or sinusoid capillary. Now this is LS and this is TS. ठीक है. तो in order to understand it properly, focus on the TS. तो TS में क्या दिखाई दे रहा है? ये देखो. This is the continuous capillary. तो continuous capillary में you can see these are the endothelium. Can you see the endothelium? So endothelium is continuous and you can see the basal lamina is continuous. Okay, and in some cases pericytes are present, in some cases it is absent. So we'll consider that pericytes are present. Okay. Next, if you see the fenestrated one, can you see the pores? Can you see the pores? Okay, like this small pores are there, microscopic. That is the fenestrated capillary. Next, pores भी रहता है and जो basal lamina it is discontinuous. That is called as sinusoids. Okay. Now lastly, this is the thing which you have to understand. तो actually क्या होता है? This is the microcirculation and role of pre-capillary sphincter. So I have mentioned about the meta-arteriole, right? जो arterioles होता है उसका lateral branches होता है, that is forming the meta-arteriole. As you can see, okay, see this is the meta-arteriole. So what is this? This is the arteriole, उसका lateral branch होता है which is forming the meta-arteriole. Okay. Now, can you see the pre-capillary sphincters? These are the pre-capillary sphincters. Now, if the pre-capillary sphincters are open and if the pre-capillary sphincters are closed, then what happens? See in the diagram. Now here what happens? Pre-capillary sphincters are relaxed. Relaxed का मतलब क्या है? Open है. Okay. Now when the pre-capillary sphincters are open at that time, what will happen? ये arteriole है, तो यहाँ से oxygenated blood आएगा, then it will go through that capillaries. Now when it is passing through the capillary, exchange of material will take place to the surrounding tissue. Okay, and then because of the permeability of the venule, okay, and then again it will enter into the venule and then it will go back to the venous system. ठीक है. Now this is taking place when the sphincters are open, relaxed. Now here you can see the sphincters are closed. ठीक है. Now when the sphincters are closed at that time, what is happening? through the meta-arteriole, the blood is bypassing the capillary and then it is entering the thoroughfare channel. And then from the thoroughfare channel, it is going into the venous system. It is going to the venule, and from venule it will go to the other veins, okay, in the venous system. So that is the importance of the pre-capillary sphincters. So it consists of vascular smooth muscle cells that surround the terminal arterioles. Okay, you can see these are the terminal arterioles at their junction with the capillaries. Now pre-capillary sphincter regulates the entry of blood into the capillary plexus. Okay, तो capillary plexus में blood कब enter करेगा, कब enter नहीं करेगा, that is controlled by the pre-capillary sphincters. Okay, so that is all about the histology of blood vessels. Okay. Now there are some slides with me, so you have to see the slides also. Okay. Why you have to see the slide? Because these topics are important, and in the practical exam questions may be asked. Okay. So everyone please go to the histolab first. काम करेंगे, अगर आज नहीं हुआ ना तो नेक्स्ट है ना तुम लोग का इसको रिपीट हाँ हाँ उस टाइम वो वीडियो को दिखाऊंगा Which one is elastic and why?
Lens में ये मस्त ये भी होता है Jadi